Hello, my name is Emily Young, and I'm going to be presenting my BSN Capstone Project Proposal on nurse-driven sedation protocol in mechanically ventilated patients. The objectives are purpose of the project, background of mechanical ventilation, problem statement, nurse-driven protocols, proposal plan, description, implementation, evaluation, dissemination, and summary. The project purpose is to reduce the number of days a patient is mechanically ventilated by implementing standardized nurse-driven sedation protocol. Mechanical ventilation is a machine with an artificial airway designed to assist patients with breathing during surgery or when they cannot breathe independently. It is an essential medical intervention in the context of critical care. In the clinical setting, there are standardized assessments that nurses are required to complete when caring for MV patients. Some are required once a shift, every 2 hours, or every 4 hours. There are specific criteria for predicting the success rate a patient will have in being weaned off sedation and ventilation. Implementing these assessments decrease the days of patient sedation, ventilation, and stays in the ICU. Nurses should follow each protocol with a patient-centered approach. In order to get an accurate assessment of neurological and respiratory status, the patient must be in the lowest and safest dose of sedation. For MV patients, that are sedated, using nurse-driven sedation protocols will significantly impact their outcomes. The proposal plan starts with proposing the idea to the right people. The stakeholders are the patients, providers, practitioners, payers, policymakers, researchers, and regulatory boards, and will all play a role in the proposal plan. Providing them with the education and evidence-based practice is crucial. The Critical Care Medicine Journal and England Journal of Medicine state that the proper monitoring tools include the A to F bundle, Richmond Agitation Sedation Score, Critical Care Pain Observation Tool, Confusion Assessment Method, Spontaneous Awakening Trials, and Spontaneous Breathing Trials. Here is a sedation vacation protocol that Mount Sinai Medical Center uses daily to assess their patient status. If the patient passes the screening that determines he or she is eligible for spontaneous awakening, they stop the sedation, and if the patient presents with any of the criteria indicating intolerance, they restart the patient at half their previous rate. This allows the patient to receive therapeutic benefits of the sedation and also being assessed at a lower sedation. Mount Sinai's protocol for spontaneous awakening trials begin 24 hours after intubation, and they start with the A to F bundle. This is an assessment of the patient's pain, agitation, sedation, delirium, immobility, and sleep disruption. This is their Richmond Agitation and Sedation Scale, and it's performed every 2 to 4 hours on all patients with sedation. This is a CPOT assessment from the American Journal of Critical Care, and it assesses patients, mechanically ventilated patients' pain level. This is from American Physical Therapy Association and states that the confusion assessment method is for the ICU, and it's a tool that's used to assess delirium among patients in the intensive care unit. It is an adaptation of the CAM, which was originally developed to allow non-psychiatrists to assess delirium in patients. Possible ways to provide education to the medical professional stakeholders included is developing software that's easy to use with easy-to-use templates that have checklists and rounding tools for standardized drug concentrations, titrations, assessments, interventions, following protocol and facility policies. Another education aspect includes ensuring that every patient that is mechanically ventilated has the protocol included in their chart upon admission or ventilation. If nurse-driven sedation protocol were implemented, the percentage of the ventilator-associated secondary complications would decrease. There would be a decrease in the length of days patients are mechanically ventilated, a decrease in the length of stay in the ICU, and increase in ICU patient outcome. For dissemination outside of the clinical setting, a PowerPoint presentation like this could be created that is short, sweet, and to the point, and will grab the audience attention fast and keep the duration of the presentation. This presentation can also be given at facilities boards of directors, the leadership of the ICU units, the in-service educational seminars, and continuing education courses. Implementing nurse-driven sedation protocols that help the patient wean off sedation and ventilation reduces the number of days a patient is mechanically ventilated, reduces the risk of morbidity, mortality, and improves patient outcomes. The protocols could be taught in the ICU interdisciplinary teams and other groups of the organization by creating a straightforward presentation about the different assessments that they should make regarding their patients. And those are my references.